Chamga chitab Kalenjin, itagat en tetutetab Health Watch, kainenyin ko Karen Cheruiyot. En wikini ko kokibwoti mionwek chetinyegei ak kidney anan ko kidney problems. Age en betutab raini takemoche keusingong tetutioniton. Age en studio kemiten ak lakwet agenge nekikuren Hope. Welcome to the show, Hope.
Thank you.
Tell me about yourself and at what point did you discover that you have a kidney problem?
My name is Hope Mutete Maria, and I discovered I had kidney problem at the age of 8 in 2009. Yeah. Yes.
What transpired until you realized that there's a problem?
I'd get tired first. And then I'd complaints of pains in my stomach. And I'd go to hospital and get tested for malaria every single now and then. And then one time I went to one of the hospitals in Nairobi and I was diagnosed with kidney problem. Yes.
After how long was that? Because you said you were misdiagnosed.
I think after
malaria.
like 3 years
Oh.
is when I got a chance to go to a good hospital, and I was then diagnosed with kidney problem.
I know you were still young at that time, but can you remember what you were feeling at that time? What your family was going through?
I think it was just that phase of, as no one could imagine, and my mom, being the only parent, was quite devastated, and because she didn't know where to start, she didn't know how to react, she didn't know that it should be a parent that would start a journey, and she didn't know how the journey was going to be. And I'm pretty sure it was bad on her. For me, I was innocent. I didn't really understand what was going on. I'd just see myself going to hospital every single day for like 2 weeks. I never got to understand. And yes, it hit me like 5-6 years later that I have a kidney problem, and this is something that I'm going to live with unless I got myself a donor to do a transplant, or else I do dialysis.
Okay.
Yes.
And now that you've understood your situation, have you known exactly what the problem is with your kidney?
Yes.
What is it?
So according to how I understand it, I was diagnosed with polycystic kidney problem, which I think it's where the cysts grow, the kidneys, or you're born with it. But when I grew and I got tested, I was told it was a kidney failure. And yeah.
Okay. So you started your dialysis journey immediately at the age of 8?
I started my dialysis journey 8 months ago.
All right.
So the doctors have been managing me for like 12 years without dialysis. Yes.
During that 12 years, you've been under medication?
Yes. Yeah. I got to do a transplant in 2016 where my mom was the donor. Yeah. But it failed, unfortunately.
Oh, okay.
Yes.
And have you tried looking for another donor?
No. Because I think when looking for a donor, I assume, or I think you get to have the kidney or the organ among your family members.
Yeah.
And it's quite difficult to
get a match.
Yeah, to get a match, or either to convince a family member that it's the better option. Yeah.
And how is it so far?
For me,
Yes, for you.
when I started dialysis, it hit me so hard because I realized it was emotionally draining, mentally draining, financially draining. And it hit me, especially mentally. I couldn't imagine, because I had to find a balance between school, personal life, and hospital 2 to 3 days a week. To find time to go to hospital, like go there 5 to 6 hours. So it was quite difficult for me mentally.
I know you okay, not even you're still young.
Yes.
And I'm sure your lifestyle is different from that of your friends.
Yeah.
How different is it, and what do your friends say to you?
Me and my friends don't get to talk a lot about my problem. I don't know why we don't talk about it, but we don't get to talk about it. So I am not in a position to know how they feel.
All right.
And to what extent do they understand kidney health in general. Yes. And yeah, when I started dialysis is when it hit me also that the diet is different. You're not supposed to get yourself fatigued. Yeah, the fact that I don't take tomatoes, and you have to soak all your meals before you eat them. Yeah, it hit me at the time that everything was going to change, and especially on the time and diet, it took a knock on me.
And so on a normal day, how does your plate look like?
On my normal day, is if I want to eat probably something with potatoes, I have to soak them 4 hours prior.
Okay.
And it doesn't have tomatoes, and I don't deep fry. Yes. And like if I want to eat something with beans or something, I have to like soak them 12 hours in time. And also when you're eating something like chicken or fries, you have to air fry them or put them in the oven. You can't eat
oil.
Yeah, you can't eat oil, deep fried foods. Yes. Yeah.
So that means that you rarely eat out.
I don't eat out.
Oh, okay.
Because I also don't eat in people's houses because I have to. Because people put tomatoes in their food, and that's something I can't do. Yeah.
Okay. And with all this experience, what would you tell people out there who've just discovered they have a kidney problem, or probably they have a family member with a kidney problem, or they might not even know exactly that there's something called kidney problems?
I think one thing about kidney problem is not advocated as much as it's supposed to be. And that's why when a family member discovers that you are, or that maybe a family member has been diagnosed, it takes a lot of time to take it in and to start the journey. And for any family member that goes through that kidney journey, I believe they need a support system. It's not easy to eat different meals, to have a different kind of lifestyle than other people out there. And I believe that they need a support system.
What would you say about your support system?
My support system. I think my support system, I've never thought about it. I think my mom and my aunt, I grew up with my aunt, who are my greatest support system emotionally, and going to hospital. When you go to hospital, I believe you just need someone to call you. Umetoka hospitali, umeingia, how was it? So I'd say my support system is quite strong. Yes.
That's great. One last thing. You did mention that it's financially draining.
Yes.
Do you know how much each dialysis session costs?
Because of the support of NHIF, it that has lifted a burden on kidney patients, because if you're doing 2 sessions in a month, they'll sponsor around 75,000 shillings. But when you're doing 3 sessions, and especially the hospital that I go to, 1 session is 12,000 shillings. So 12,000 times 3, that is 36,000 a week. Yes. And the medicines, the tests, seeing the doctor. Overall, I have seen that financial drain among my family members, or among my mom and my aunt. Yeah, it's financially draining. It is.
Well, I wish you the best in your medication. I hope you
Thank
get
you.
a donor soon.
Thank you.
And thank you so much for finding time to come and be with us here today.
Thank you.
Chitab Kalenjin, amangole kainegit aenge anangoeng agoba kidney problems. O imuche kosich chi age tugul. Ak kogengalal ak daktari taingi kobun Aga Khan Hospital. Nenaat ko Dr. Sakwala. Ago aini gini ko imuch komwawech.
Right, so it's percentage of the population. If the population increases, the statistics will go up, and we know the Kenyan population is on the rise. So the statistics always are going up. The reason why they said 4 million at that time, because at that time the population was around 40 million projected, and that's around 10% of the population. So projected population right now is around 55 million. So obviously the numbers have gone up. Maybe I would say people with kidney problems, any kind of kidney problems, is around 5 million. And those getting care probably would be like 20,000, and those requiring dialysis will be like around 5,000, 6,000 people in Kenya. Kidney disease itself is a silent disease, okay? You can be having kidney problems, but you can't know until it's very late. So those 5 million are people with mild kidney disease to severe kidney disease, right? So you're very right that a chunk of that people maybe have not gone to a hospital or a doctor because they don't have symptoms. And the only way to pick it up is by doing some tests. Symptoms of kidney disease, when it's, getting towards the end stage, or, more severe form of kidney disease, the symptoms include swelling in the leg, blood in the urine, a lot of frothy urine. When you start peeing and you see on your tub, there's so much froth, just like the way the beer froth, right? And that is you're leaking protein in the urine, or you're getting tired very quickly, or you have nausea, vomiting. That shows that you have toxin buildup in the body, and you can't really eat much food, you don't have appetite, you have a headache, you just want to sleep. Those are some of the symptoms of kidney disease, but that happens towards now, let's say stage 4, stage 5 of kidney disease. Earlier stages, they don't have any symptoms, so, preferably people who have diabetes, high blood pressure, they get kidneys checking at least every 6 months or every year, because those are the main diseases which cause kidney problem. And obviously, if you're above 40, then at least get a routine check done. The younger generation can also be affected by kidney disease, and these are genetic diseases, right? Most of the time, one of the most common cause is what we call reflux disease. Okay, you have the bladder, and then you have where you pass urine, and then the ureters are connected to the kidney, where they drain into the bladder. So what happens is there is a valve between the bladder and the ureters, and if that valve is not functioning very well, the urine starts going up into the kidney instead of coming out when they want to pass urine. So that affects the kidney, okay? And if it stays like that for some time, the kidneys get scarred and the function deteriorates. That's one. Second one, we also get something called nephrotic syndrome, inflammation in the kidneys in children. And again, if that's not picked up early, then they get kidney problems. And again, other diseases, things like sickle cell disease, malaria, infection itself can all cause what we call acute kidney injury, and if it's not treated well, then it can lead to chronic kidney disease. Of course, in the older age, let me go back and say the most common cause of kidney failure in the adult population is diabetes. Okay, followed by high blood pressure, followed by what we call glomerulonephritis, that's inflammation in kidneys. So diabetes, hypertension is lifestyle diseases, as you know, most of the time, okay? So if your lifestyle is a healthy lifestyle, then you prevent getting diabetes, even if you have predisposition to getting diabetes. Healthy lifestyle, regular exercise, adequate diet, not eating a lot of junky food. For high blood pressure, avoiding a lot of salt, regular exercise. Again, those things prevent you to get kidney disease. Again, if you take medications which are over the counter, which are affecting the kidney, then you'll get kidney problems as well. Things like, what we call NSAIDs, what we call the Brufens, the diclofenacs, and if you take that for a long time, for a short period of time, like 3 to 5 days, it should be okay, but if you take it for a long time, then your kidneys get affected. When patients come to see us, the main thing is whatever blood tests, whatever scans they've done, they should bring them to us. The other most important thing is drugs, medications. All the medications they take, they should bring them so that we assess which medications are good for the kidney, which medications are not good for the kidney, what to stop, what not to stop, and adjusting those have an impact on the kidney survival. So kidney disease ranges from stage 1 kidney disease to stage 5 kidney disease. So stage 1 is mild disease, stage 5 is severe disease where you need dialysis. That's for chronic kidney disease. And then we have an entity called acute kidney injury. That's when your kidneys are fine, and then suddenly, for example, you get an infection, you go into the ICU, or you're getting admitted to the hospital, your blood pressure goes down, your kidneys don't get enough blood, and then they go into a shutdown phase. Okay, they go to sleep in layman's term. And because the toxins build up in the body, you need to help the body by doing dialysis, taking over the function of the kidney until the kidneys start recovering by themselves. So that's acute kidney injury. So we'll talk about chronic kidney disease. As I said earlier as well, the most common cause of chronic kidney disease is diabetes, followed by high blood pressure, followed by something called glomerulonephritis. In this part of the world, we see a lot of glomerulonephritis which is missed, which is not picked up. That's why we have very young people who are on dialysis. Okay, in the West, we have older people, mostly because of the diabetes, the high blood pressure, which is causing the kidney disease. And if they get glomerulonephritis, they're picked up early. Here, people with glomerulonephritis don't see the doctor, or if they see the doctor, they're just treated like urinary tract infections and sent home. You don't get a kidney biopsy, you don't treat it adequately, and your kidneys end up, dying off. Okay, so those are the 3 main causes of chronic kidney disease in this part of the world. So we've talked about the symptoms and prevention. Okay, and treatment is mainly prevention again. Okay, avoid painkillers, healthy lifestyle. It's a multidisciplinary approach you can do. Regular exercise, adequate fluid intake, reduction in salt intake, and then now you go to specific treatments. Then if you have diabetes which is causing your kidney disease, then better glucose control, okay, better sugar control. It's not like your sugars are very high, they affect the kidneys just like they affect other organs like the eyes, the heart, the nerves. They also affect the kidneys. So make sure that your diabetes doctor or yourself maintain your sugars very well controlled. High blood pressure, again, make sure your blood pressure is very well controlled. Okay, below 130/80 is what ideal we want. Systolics of 130 and diastolics of 80. Anything above that will affect the kidney because all that is pressure to the kidney. Again, avoid over-the-counter drugs. Okay, visit your doctor regularly, and if your kidney disease is because of things like glomerulonephritis, which I mentioned earlier, then ideally get a biopsy, kidney biopsy, know what's causing the glomerulonephritis, and treat accordingly. Usually these are autoimmune diseases which are treated with things like steroids and other autoimmune modulators. Okay, so that's the main thing to do. Sometimes you don't pick it up. You think this is a urinary tract infection, but it actually is not a urinary tract infection. It's actually inflammation inside the kidney. So if you've treated a patient with, possible UTI and you still have something like protein blood in the urine, it's better to see a kidney specialist. We have around 50 nephrologists in the country, which is a good number, and we also are training more nephrologists in the country as well, the East African Kidney Institute. So every year we're training around 5 to 6 new nephrologists who are, and some also go outside the country and come back. So the number is growing. One thing, healthy lifestyle. Number one, avoid your fast foods, avoid, your junk foods, regular exercise. If you have any problems like the ones I've mentioned, swelling in the feet, blood in the urine, frothy urine, facial swelling, feeling unwell, nausea, vomiting, see your doctor as soon as possible. Ask them to make sure your kidneys are okay. So this is the dialysis process going on right now, and this is the dialysis machine. Okay, it's a simple thing. What happens is you take blood from the patient. Okay, it goes through the machine and goes through the filter, and this acts like a kidney. All right, so it filters the blood from all the toxins which are built up in the body. And the function of the kidney is multiple. Okay, one, it gets rid of waste products like whatever you eat. You don't think about that, right? So all those are not necessary in the body, the kidney removes, okay? Things like sodium, potassium, the acid, extra water. You keep drinking water, but you just go to the washroom and just pass urine, and it goes away. So the function of this is to clear all those toxins, one, and even remove extra water from the body. People whose kidneys are not working, they can't get rid of the water. So whatever they drink, if you don't remove it with this machine, they accumulate in the body, and they get things like difficulty in breathing because it accumulates in the lungs. So blood comes in here and gets cleaned and then goes, that's with the pump, and then it goes back to the patient, right? As simple as that. Usually ideally 4 hours a day, 3 times a week, okay? Your kidney functions 24 hours a day, 7 times a week, but we try to do that with just 4 hours, 3 or 2 times a week. Yeah? So this is probably, you could say, a temporary measure before the permanent treatment is kidney transplant. Okay, so let me talk about the kidney transplant. Is when you get a new kidney from one of your relatives, okay, who match, and you put a new kidney, so you don't need to come here to get this done every week, 3 times a week, right? So then that kidney takes over the function of this dialysis machine, or your kidneys which are not working. Usually not 3 times a week, but once a month you do a test. Because one of the other functions of the kidney is to make blood. It secretes the hormone which makes the blood. So if your kidneys are weak, you don't secrete that hormone, so your HB goes down. So usually check a hemoglobin every month. Usually check one of the electrolytes called potassium every month. Okay, so things like assessment of your urea, your creatinine, your potassium, your hemoglobin, how well the dialysis is happening, your ureas, your creatinines as well are important. So, NHIF usually caters for this, and NHIF pays around 9,500 per procedure.
Ongetien wiki nenyone astagamut kengaral agoba tetutik cheterter chetinyege ak miinda borto. Kainenyin ko Karen Cheruiyot.